Uganda is prone to public health emergencies and other disasters. These include floods, landslides, and man-made disasters like accidents.
Any nation or any community can at any time go into an emergency. So it would rely on availability of emergency medical teams. These are not necessarily only one professionals. These are not only doctors, but it's a whole group of people who are there to respond in emergencies.
You must have public health workers or people who can be able to make decisions, synthesize information as it comes through.
Come in at a time when an event occurs to quickly turn it around.
In case of emergencies, we sometimes require to bring in people from other countries.
I was here for a period of 6 weeks or supporting emergency response in different countries, because by that time I was based in WHO Eritrea.
So under the emergency medical teams, we are also developing a specialized care team.
There are trainings and exercises you need to do to make sure that you have an updated and capable team.
There's a certification and accreditation process that they undergo through WHO, which has been developed through a lot of consultations with other organizations that work within this space.
And as you can see, we've just had a 7-hour drill as part of our support to the Ministry of Health, capacity building for emergency medical team.
What we train is, we train for all eventualities. It could be a flood, it could be fire, it could be landslide, riots, anything that where life and property are at risk and the system is overwhelmed.
Such that when an event like that happens and it's outside the infectious diseases domain, then we can be able to mobilize that team.
For example, you might bring the driver from Kampala, the surgeon from Gulu, the nurse from Kabale.
I am Dr. Etolu John Wilson. I'm a consultant physician working at Soroti Regional Referral Hospital.
My name is Asava Allen. I'm a civil engineer by profession, civil structure, and I work in the Health Infrastructure Department at the Ministry of Health.
But some of these emergencies quickly overwhelm that local system, and you require additional support.
That has to be built at the national level and also at the subnational level.
Having them at national level offers a unique advantage in that they are more easily deployable within the borders. It is easier to organize them. You don't need flights, you don't need visas, you don't need pre-travel vaccine shots and that whole process that can delay mobilization. They are also licensed already from a legal point of view. They already have licenses to work within that country. They understand the local context. They will be able to speak the language. They know the framework within which the country works. They know all the local rules and regulations.
That's the reason why the people that actually provide that response should be very well trained, and they should be well aware of the events that they're participating in. Not everyone can participate. It has to be specialized teams that have been oriented in how to provide care during those events. That's akin to what happens with an emergency medical teams, that you have these teams that are always on standby. When an event occurs, you are able to mobilize them and deploy them into that specific element. And as a country, we are seeking to even go further and make the emergency medical teams develop key attributes where we'll have specialized care teams within the emergency medical teams.
And this is the type of things we need to build throughout the continent. And here I would like to appreciate the European Union ECHO program on the emergency medical team trainings and building that capacity, because that would enable us to respond better for the next outbreak or next emergency, but also that would enable us to build an asset for the continent if the Ugandan teams are required to be deployed into other countries for another emergency.